types of cancer and take steps to prevent it. This is Dr. Murali Subramanian. Welcome back to my podcast channel, Cancer Care. There are many common cancers in women, but we will be discussing the 5 most common types of cancer in Indian women. But these life-threatening cancers can be prevented if detected and treated at an early stage. It is important to go for annual cancer screenings. This would help reduce the mortality rate and also improve the quality of life of the patient after cancer treatment. The 5 most common cancers affecting Indian women to be aware of are the breast cancer, the cervix cancer, the oral and the lip cancer, ovarian cancer, colorectal cancers. Breast cancer. It is the most common cancer affecting women in India. It accounts for more than 25% of all cancers. 1 in 26 Indian women could develop breast cancer. In the rural areas, the number is on a lower side, but in the cities, it is about 1 in 20 women. Women of any age can develop this cancer. Symptoms: inward turned nipples, lump in one or both breasts or armpits, soreness and discharge in the nipples, discharge from the nipples, change in the shape and size of the nipples or breasts. Preventions: a woman with a family medical history of breast cancer needs to be more cautious. Remember that it is easier to treat breast cancer if diagnosed at an early stage. It is important for women over the age of 40 years to go for screening mammograms. It is important to self-examine to feel the lumps or any other abnormalities in the breasts. Every woman must check for any variation in size or shape of the breast. If you feel there is something abnormal, you must consult a doctor immediately. You must do self-examination once every month. Cervical cancer. It is the second most common cancer found in Indian women. Cervical cancer accounts for about 20% of all cancer cases in Indian women. In this case, rural women are at a more higher risk of suffering from cervical cancer than urban women. This is more common in sexually active women. Cervical cancer is most commonly caused due to presence of human papillomavirus or HPV, which is a sexually transmitted infection. Other causes of cervical cancers include tobacco, AIDS, poor nutrition, genital infection, weak immune system, multiple sexual partners, long-term use of oral contraceptive pills. Symptoms: unfortunately, in its early stages, cervical cancer does not show any symptoms. However, with the advancement of cancer, the following symptoms may occur: vaginal discharge, pain during sex, abnormal vaginal bleeding during sex, or after menopause, or between periods. Prevention: practice safe sex to lower the risk of infection and getting this cancer. Avoid smoking to prevent cervical cancer. Go for pap tests and follow up with the doctor. It can also be prevented by getting vaccinated for certain HPV infections. It is advisable not to use birth control pills for a long time to prevent cancer of the cervix. Maintain a healthy body weight and eat a healthy diet with more organic fruits and vegetables. Oral and lip cancer. It is one of the most common cancers affecting Indian women. Women over the age of 50 years are more prone to oral cancers. Symptoms: small lump inside the oral cavity, erosion surrounding the gums and lip, loss of sensation inside the mouth, abnormal patches in the mouth or throat, bad breath and loosening of teeth, problems in speech, severe and unexpected weight loss, painful sores. Prevention. Maintain proper oral hygiene and visit a dentist regularly. Also, you can conduct a self examination of the mouth. Avoid smoking or chewing tobacco. Ovarian cancer. Ovarian cancer mostly affects women when they are above 50 years. Women with a positive family history of breast cancer and ovarian cancer are more prone for this cancer. Symptoms: pelvic pain, digestive problems, abdominal swelling, bloated sensation, a sense to urinate all the time. Prevention: regular health examination and relevant tests can help, but there are no definite screening tests available for ovarian cancer. Colorectal or colon cancer. Women with a family history of colon cancer or suffering from an inflammatory bowel disease are at more risk of developing colon cancer. Other causes are obesity, high fat foods, being inactive, and smoking. Women between the age of 40 to 50 years are mostly affected. Symptoms: fatigue, abdominal weight loss, abdominal cramping, blood in stool, change in bowel movements like constipation, diarrhea. Prevention: healthy lifestyle changes and start eating healthy foods that include vegetables, fruits, and whole grains. Also, you can start taking vitamin D and calcium supplements after consultation with your doctor. Maintain a healthy weight, limit alcohol consumption, avoid smoking. All these can reduce the risk of colon cancer. Limit the intake of red meat and exercise in order to prevent colon cancer. Conclusion: data shows that cancer is increasing in Indian women. Regular screening can definitely prevent certain types of cancers. But note that all cancers cannot be screened. Cancers which are detected at a very early stage will have a better chance of cure as well as having a good quality of life. That's all for today's podcast. I will be back with another informative session for the benefit of the public. Until then, this is Dr. Murali Subramanian signing off. Take care and stay blessed.